everyone, we're OTA students at Sacramento City College. My name's Jenna, this is Adriana, Christine, and Johanna, and we're going to answer the question, can severely disturbed children learn social problem solving skills, based on 3 research articles that we found.
So my article is about the Positive Behavior Intervention and Support, PBIS. It is a system to help schools for continued use of evidence-based interventions and proven instructional techniques. So basically we want to prove that with a non-punitive methods of teaching, it is possible to teach severely disturbed children problem-solving skills or social problem-solving skills. Because in the past, punitive techniques such as restraint, seclusion, or lecturing have been shown ineffective in eliminating unacceptable behaviors in the past. So the PBIS model focuses more on modeling positive behaviors, reinforcing positive behaviors, and using non-punitive methods to correct troubling behaviors. So how was the research conducted? So the research was conducted in 3 different sites and implemented in a day treatment program and residential treatment programs with severely disturbed children. There was a higher percentage of male students compared to female, age ranging from 10 to 15 years of age. The racial makeup were Caucasian students, about 55%, following African American and Black students at 34%, and other race about 1 and 8%. The team used surveys to collect data on staff attitudes, documentation of incident reports to track safety holds, physical and verbal aggression, and other serious behaviors. So the question we want to address is it possible to teach severely disturbed children social problem skills? So the result of the research shows 60% decrease in support, room referrals, and safety holds in all 3 sites. And the barriers that we faced was the research was only conducted in the state of New York. The racial makeup was only limited to like Caucasian and African American students. The population was more predominantly for the male students, and but the study did prove that severely disturbed children can learn problem-solving skills, the ability to correct inappropriate and bad behaviors, and develop positive behaviors through coaching and role modeling validates that research. I did show the racial and the percentage of the racial makeup and population of the students. Joanna?
All right, so my article that I have researched is called Systems Collaboration with Schools and Treatment of Severely Emotionally Disturbed Children and or Adolescents. In this study, there are about 38 students that were considered participants. The study used a structural equation model to explore potential effects, of system collaboration with schools and influencing children's behavior outcome as mediated by family variables like parental competence and family functioning. The definition of system collaboration is as an interpersonal process through which members of different disciplines like schools, therapists, administrators, teachers contribute to a common process or goal. This study was done by collecting audio or visual tapes on initial family sessions, 35, 17 6-week family sessions, and 9 consultation sessions where IFAST, which is Integrated Families and System Treatment Case Managers, participated in supervision with the IFAST consultants. Right. So the results of the study where the findings provided support to the hypothesis that parental competence and with children that have serious emotional disorders impacted the systems collaboration that was stated earlier with schools on the children's problem severity and their overall functions. So some strengths of the study was the system collaboration model led to greater functioning in children and reduced severity of problems and behaviors when parental competence is enhanced. This study also showed the importance of collaborating and cooperating, particularly when working with the students with serious emotional disorders and their families. Some limitations were the sample size was very small, as there was 38 only, and the use of self-reports from the IFAST was specifically from the case managers and not the teachers and or other school personnel that was collaborating with in the schools or therapists. And participating families were most white Americans, and other ethnic groups were not represented. So the application, so this relates to our question on how seriously disturbed children can learn social problem solving skills, because in order for them to learn those problem solving skills, they need to have the parents and everyone in the school function collaborate together to teach them when it is appropriate and not appropriate to behave when it is. So I have a couple of charts. This was the demographics of the study. And then this was how system collaboration kind of collaborates with everything in the study. Right? And then this was everything put together with the parental competence, system collaboration with schools, and the cooperation and helpfulness, and the family functioning.
Okay, so the article that I chose was Reducing Problem Behavioral Through the School-Wide System of Effective Behavioral Support, and the investigation of a school-wide social skills training program and contextual interventions. So this was a pretty interesting because it was school-based. The purpose of the study was to explore the effects of social skill introduction program combined with direct intervention on problems of behavior across the school settings such as cafeteria, recess, and hallway transitioning. The participants were grade levels 1 through 5, and it basically was 110 students. And the method was used the staff formed an effective behavioral support system, and the team was called EBS, and they set a certain amount of rules, taught the rules to the students and to be enforced or reinforced with tokens. And one of the school rules was to be kind, to be cooperative, to be respectful, peaceful, and safe. They used specific settings. Where am I at? Sorry. Okay, specific settings that were problematic, like we mentioned before, where it was the cafeteria, the hallways, and transitions, when they would transition to classes. The results is that it did reduce overall problem behavior, but it wasn't completely eliminated, so it was just reduced. The strengths was that it was a unified team. The administrator provided necessary support to the team, and all procedures reflect the school's unique needs. So everybody was all together on this and for the study to work out. And the limitations were that the long-term effects of the intervention are unknown. The individual effect of one treatment condition cannot be found out for certain due to possible multiple treatment interference. And results from the study indicate possible functional relationships between the interventions and outcomes, but not provide conclusive data.
Okay. So how does this all relate to OT, and how does this relate to us specifically? One is the demand. There, in this picture here, it shows the increase in mental illness. 1 in 5 U.S. adults experience mental illness. 1 in 25 experience serious mental illness. But the key point here is about 17% of youth experience a mental health disorder. That's where we can come into play as far as early intervention. We are all well aware that early intervention is key. So before they get to the 1 in 25 or the 1 in 5, we can pay attention to the youth mental health illness and really focus on that. And that's where we as OT practitioners can come into play. The training, that's one, family training is certainly a part of occupational therapy. Based off of these 3 research articles, we understand that parental competence is key. A team of collaborators are key. And who can train those people? Us, occupational therapists. We can, describe the importance of working as a team. It has such a positive influence on these young adolescents, specifically grades like 1 through 5. That's where we can really have a huge, profound effect. Once they get into adolescence and early adulthood, it's really hard to intervene. But again, early intervention is key. The importance of this using like evidence-based research and techniques and strategies, that's where we as skilled professionals can come into play. We researched these specific 3 articles, and they all kind of have really underlying the same effects. A team is huge. A team of support personnel is huge. Reinforcing positive behaviors, whether that's through
The reward system.
a reward system or a token, something along those lines is crucial in how to have a positive effect on these behaviors. Whereas right now, as described in all of our articles, punitive behaviors have been the most common. Don't do that, whatever it is, or go to detention, you're suspended. That doesn't necessarily work for this specific population.
No.
And I don't know if anyone else has anything to add. Or how we want to connect.
Go ahead,
it
Joel.
all.
Mine is more the parental competence. It's very important that parents set a good example for these kids that have serious emotional disorders, because if you have parents that are seriously scolding their kids or yelling at them day to day, that's how they have the negative behaviors in their social setting. So you want to make sure that you give them praise and give them good, so they have good outcomes later in their life.
And I know Jenna mentioned earlier was the importance of the grade level. We saw that percentage there of 17%. They start from say ages 6 to 17. They have that youth where we can grab them there, where they won't have to expand to the other numbers. And we know it's very important to get them at that age, because we are showing them how to behave appropriately. When you show somebody how to behave appropriately and what to do in a social setting, you're showing them how to be socially appropriate with others and what to expect. So that helps in so many ways, and there are aspects for them to grow up into adolescents who are socially appropriate, because there is a large problem with that with the ED population. So when you go ahead and teach them all that, then that helps them to get to being productive adults that know what's socially appropriate, and helping the parents. So as we see here, there on all these, most of these studies, there's a team, because it does take a village to go ahead and raise a child, and we are going to be part of that village of the OTs going into that. And as we know, mental health and other doors are being opened to us, and so we are going to go ahead and help the ones that cannot be helped right now or need that help.
So thank you
you.
for coming to our
Bye.
presentation.